I'm Dr. Robin Steely, and I would like to share with you what oral fitness for life means to me. When a dentist uses the label of wellness, it implies that he has taken a holistic path. This path is the road less traveled in the dental profession. True oral health cannot be dispensed by placing crowns, fillings, implants, or dentures in any patient. That is strictly managing the disease. In the truest sense of the word, the dental health physician is exactly what the name implies. It refers to a dentist that looks to health as the standard of care and relates everything that he does to that high standard. He understands that attaining oral health is the result of his office being a learning institution where the doctor becomes the teacher and has a healthy interaction between himself and his patients where their mutual roles are defined and agreed upon. It is an interdependent relationship based on values and mutual trust. The doctor becomes the teacher and the patient becomes the student. This creates a comfortable environment where meaningful discussions about goals and values can take place. The doctor and patient work together to understand the stories that led to where the patient finds themselves and developing solutions that are in the best interests of each individual. The traditional dental practice is built on taking disease away from the patient. While this may seem the appropriate thing to do, it is really only managing the slippery slope of disease. A little disease always leads to a little more and perpetuates a vicious cycle of continuous repair and expense. Let's look at some of the differences between a traditional approach to dentistry and an oral fitness for life approach. Traditional dentistry looks at the mouth as parts of an oral system. The office is oriented to how much they can produce in the fastest amount of time. There is an emphasis on treatments rather than discovering causes, and the treatment services are heavily influenced by insurance benefit allowances. An oral fitness for life approach understands the connection between oral and systemic health. What happens in the mouth always has consequences in the rest of the body. The oral system is just that, a functional system that works in conjunction with other systems to produce a whole. The oral fitness for life approach sees relationship building as a primary focus and discovers causes before any treatment is considered or started. This approach understands that a future value of care is much less expensive in the long run than the lower cost of usual care, and it doesn't allow any third-party or insurance decision influence. The elephant in the room for many people is the issue of dental insurance. Dental insurance began in the early 1970s with a $1,000 benefit for patients to have treatment done. It started as a contract between an employer and his employees for the benefit. To achieve the same level of benefit from the early 70s to today, that benefit would have to be about $7,200 per year. In real numbers, the value of the $1,000 or $1,500 benefit really is an allowance of less than $200 today. When insurance contracts are allowed to dictate treatment, they are only considering their profit margins and not the health of each patient. Let's look at some specific differences between traditional dentistry and the oral fitness for life approach. In gum health, traditional dentistry sometimes measures the gum tissue and most often cleans the teeth. The oral fitness for life approach utilizes highly specific plaque and bleeding scores in combination with microbiologic testing to determine the specific high-risk bacteria that are present. Once this is determined, specific coaching to eradicate these oral systemic disease-creating bacteria are individually developed. Each patient is different, and there is not a one-size-fits-all approach. While the teeth may be polished, the goal is to completely eliminate bleeding and thus reduce the risk of heart attacks, strokes, diabetes, and other autoimmune diseases by as much as 7 times. In tooth health, the traditional dental practice checks for cavities, repairs and replaces missing teeth, whitens teeth, and works on people. The oral fitness for life approach teaches individuals how to decrease their susceptibility for decay by lifestyle and behavior changes, pH monitoring, and interactive involvement of each person. From a biting system perspective, the traditional practice has people wear night guards and take medication for their headaches and tooth grinding. In Oral Fitness for Life, we seek to understand the causes of this dysfunction, understand the relationship between the form of the teeth and the function of the teeth, stabilize the jaw joints to relieve symptoms, and develop treatment protocols that are designed to last and be aesthetic. The Oral Fitness for Life approach is one that seeks patients who want to look at a bigger picture and a preferred dental future. When each patient looks in the mirror and sees themselves exactly as they are and visualizes what they really want to be, the Oral Fitness for Life approach will guide them to develop their own plan and realize their goals and dreams. Great teeth do equal a better life.